Hey guys, so today I'm going to present on skin cancer, and we're going to talk about melanoma, squamous cell carcinoma, and basal cell carcinoma. So skin cancer is an uncontrolled growth of abnormal skin cells occurring when unrepaired DNA damage to skin cells trigger mutations or genetic defects that lead the skin cells to multiply rapidly and form malignant tumors. Damage to skin cells are most often caused by UV radiation from the sun or the tanning bed. The body is composed of trillions of cells, and these cells grow, mature, function, and divide throughout a lifetime into new cells. And these new cells will eventually die off into regulated systems. The growth and death of cells are regulated by the DNA present in the cell's nucleus. Cancer begins when the cells within the body grow without control. When DNA is damaged, it can typically repair itself. However, if repair fails, the cells will kill itself in a process called apoptosis. If both of these mechanisms fail, then the cell can continue growing and passing its faulty DNA to newly formed cells. These newly formed cancer cells can also invade into other tissues, which is something normal cells cannot do. A damaged DNA can occur by exposure to the sun's UV rays, exposure to radiation, exposure to cigarette smoke, exposure to any toxins that can get to your skin, and it can be inherited by parents. And although these factors are being noted, there is no clear sign of what causes damaged DNA. The three classifications of skin cancer and the most common types that we're going to talk about is squamous cell carcinoma, basal cell carcinoma, and melanoma. Squamous cell and basal cell carcinoma occur from overexposure to UV rays or radiation. Melanoma can also occur from overexposure to the sun, but it can also be determined by the number of moles on your skin type, and your family history. Squamous cell carcinoma occurs in the squamous cells, which compose most of the skin's upper layers. If you remember from A&P, upper layers is the epidermis. Squamous cell carcinoma appears to be thick and rough, red scaly patches, and it can come up on sun-exposed areas of the skin that are usually 0.5 centimeters or less in diameter. You can see from the pictures that they look like warts with like crusty surfaces. Basal cell carcinoma occurs in the basal cells, which line the deepest layer of the epidermis. So it is in the epidermis like the squamous cell, but it's in the outermost layer. You can see by the picture it's raised pink waxy bumps, and they can also have superficial blood vessels and a central depression. Melanoma is the most dangerous type of skin cancer, and it originates in the pigment-producing melanocytes in the basal layer of the epidermis. And it can appear to have brown or black skin lesions with irregularities in symmetry, color, and border. There are 4 different types: superficial spreading, lentigo maligna, acral lentiginous melanoma, and nodular melanoma. And here is a picture of all. I apologize if it's cut off in the slide. This is my 5th time redoing it, and I keep trying to get all of this into one picture. The superficial spreading is the most common type of melanoma, and it counts for 70% of most skin cancer cases. This type is most common in young people. It appears in the top layer of the skin for a long time before it can penetrate deeper. The first sign is flat or slightly raised, discolored patch with irregular borders in a somewhat asymmetrical form. So it looks like a mole that's grown a little bit, changed colors, and it doesn't have any regularity around the border. It doesn't look like a circle. Lentigo maligna is similar to superficial spreading in that it remains close to the skin for a while before it can spread more to the deeper layers. It usually appears as a flat or mildly elevated tan, brown, or dark brown discolor mole, as you can see in the picture. Lentigo maligna doesn't get to add the word melanoma onto the end of it until skin cancer is detected. A fun fact about this is that it is most common in people in Hawaii because it is from overexposure to the sun. Acral lentiginous melanoma, it is also superficial. It begins superficial before spreading to the deeper layers. It is quite different in appearance. It appears as a black or brown discoloration under nails or on the soles of the feet and palms of the hands. This type can advance more quickly than the previous two that we just talked about, and it's most common in African Americans and Asians. Oh, I'm so sorry. Nodular melanoma is usually invasive at the time of diagnosis. It is recognized when it becomes a bump. It usually appears black, but can also be blue, gray, white, brown, tan, red, or it can even be the color of your skin tone. It most frequently occurs on the trunk, legs, and arms, and it is mainly found on elderly individuals or the scalp of a man. This is the most aggressive form, and it's found in only 10 to 15% of all cases. And this is a really cool picture that shows the layers of the skin and where each skin cancer will occur. The prognosis of skin cancer is dependent on the type of skin cancer you have and the stage of cancer in which you were in. The type of procedure used to remove the cancer could also determine prognosis. So I have the stages listed from 0 to 4, 0 being the best stage that you could be in and 4 being the worst. So stages of cancer is defined as the extent of cancer in the body. The stage is usually based on the size of the tumor, whether the lymph nodes contain cancer, and whether the cancer has spread from the original site to other areas of the body. Basal cell and squamous cell carcinoma have an excellent outlook when it is detected early and treated, and if the lesions are removed quickly. Malignant melanoma has a 5-year survival rate of 100% if the lesions are removed early, but if the lesions do become thick and spread to other parts of the body, which is indicative of the late stages of cancer, then there is a very poor outlook. There is medical treatment used to remove the skin cancer, and it's dependent on the size and the stage of the cancer. Treatments that they may do include freezing, excisional surgery, which most of the time is when the cancer is on the most superficial layers of the skin. Mohs surgery is when it's gotten a little deeper, and is what they'll do is they'll take off each layer of your skin until they get to a layer where they don't detect skin cancer. Drug therapy is dependent on the stage of the cancer as well, and it can include radiation therapy or chemotherapy. So occupational therapy can be used in a numerous number of, sorry, I just kind of used numerous and number all in the same sentence. OT treatment. There are a lot of different ways that occupational therapists can treat skin cancer. First and foremost, we definitely want to do education on how to prevent skin cancer. And the education can include avoiding the sun during the middle of the day, wearing sunscreen, protective clothing, avoiding tanning beds, and doing a skin check once a month. After the removal of a tumor, decongestive therapy can be completed, and this includes skin care, scar management, lymphatic draining, and bandaging. Along with scar management, there's auxiliary web treatment, and this is following lymph node removal to avoid scar tissue buildup. So what they recommend is where the lymph node was removed after it heals, they recommend doing moist heat, manual stretch, exercise, and pain management like Tylenol or pain medicine, just to make sure that scar tissue buildup doesn't get in there, because that can cause more problems. If drugs such as radiation or chemotherapy are required, OTs can provide a number of services to improve the quality of life. We can, adapt, modify, or provide compensatory techniques in activities of daily living and instrumental activities of daily living. We can provide energy conservation techniques and help patients complete task simplification so that they can get more accomplished in a day without getting overwhelmed or exacerbating their systems. It is important with patients who are going through radiation and chemotherapy to keep their strength and their endurance up. So strength and endurance training is very important. And I always feel like family education is an awesome part of the OT treatment. I feel like the more support that a patient has, the better off that they're going to be. So keeping family educated in the process is very important as well. This is just how to check skin for skin abnormalities. They call it the ABCDEs of skin cancer. And this is a link to a really good video that just shows you how to check for places on your body, where to start, how often to do it. And I think it's really important for everyone just to do these things, because skin cancer can slim by if you're not really familiar with the spots on your body. All right, guys, thank you very much. I look forward to getting some questions for you guys and providing you with answers and any more information that you might want to know about skin cancer. And if you guys have anything to provide for me, I'm always willing to learn also. All right, thank you.